Well, hello, all my baby boomer friends out there. This is Bill Gladden. You know, in these crazy times during this pandemic, it's more important than ever that we pick the right health insurance, especially going into this fall and this winter. It's supposed to be rough. So I want to make sure that whatever plan you do get, we're picking the right one that's the best plan for you. And today I'm going to be talking about the new Medicare Advantage plans for 2021. Now, there are 4 new plans for the Kansas City and St. Joseph area available for 2021. Let me tell you, the benefits have improved. However, there's some things you want to watch out for on these kind of plans. If you've had one of these plans, you already know what I'm talking about. But if it's new to you, the one thing you might want to watch out for are the hospital co-pays. They can be anywhere from $295 to $350 a day for days 1 through 6. The other thing that you might want to watch out for example, are things like there's a copay for an ambulance. Now, an ambulance ride might cost you anywhere from $295 to $350. Or outpatient surgery is another thing. Again, that could be anywhere from $295 to $350 a procedure. So these are things you kind of have to prepare for. But what I'm going to put together is what I call this complete plan. So I'll explain that here in just a second. Now, these kind of plans, they offer benefits beyond what normal Medicare will offer you. For instance, you get free gym memberships, to fitness centers to work out. Over the counter, meaning they'll give you money to buy things you would get at the drugstore that aren't prescription. Things like bandages, Bengay, aspirin, things along that line. So let's talk about the 2021 Complete Advantage Plan that I put together for my clients. Now, a doctor visit, you don't pay anything. Specialists, you can pay anywhere from $35 to $50 a visit. Tier 1 and 2 drugs, they're free. Don't pay anything for a 90-day supply. You got to love free. Now, that ambulance I was telling you about, you pay anywhere from $295 to $350 a ride. Hospital stays, again, $285 to $350 per day for days 1 through 6. Outpatient surgery, cataract surgery, for example, or knee surgery, something like that, $325 to $350. Hearing aids, glasses, and contacts, great benefits. You get that for free. I'll tell you about that in a minute. And of course, I already mentioned that fitness health club membership. But remember, what makes this a complete advantage plan is this. Look at the ambulance transportation. You're not going to have to pay that $295 to $350. Instead, we'll bring that down to $45 to $95, depending on the plan. The hospital room stays, well, you're not going to have to pay up to $350. You'll pay nothing. Same thing for the outpatient surgery. You don't have to pay those co-pays. You pay $0. Pretty cool. That's what makes this plan complete. Plus, there's going to be an additional benefit at the end of this that I'm saving it for the big finale. So let's move on. There is a plan available called the High Deductible Elite PPO plan. And this plan has a $1,000 deductible. But the deductible only applies for certain things. For instance, if you were admitted to the hospital or outpatient surgery or dialysis, for example, or if you had to go out of network, you'd have to pay that $1,000 deductible first, and then the insurance would kick in. However, for the regular stuff that most of us go see anyway, things along the line of when you go see your doctor or your specialist, or you're getting x-rays, routine x-rays, or eye exams and hearing exams, or medical supplies, or the ambulance or emergency room, the deductible doesn't apply for that. It only applies toward if you're getting to the hospital, basically. And it also doesn't apply to your drugs either. And by the way, drugs are included in this plan. Now, here's something I found really interesting because I needed these. You're going to get free hearing aids. I'm talking really good hearing aids. Not only that, but when they hook you up, you get 3 years worth of batteries. And for these level 1 and level 2 hearing aids, they're going to give you $1,250 per ear. So you notice there's 0 cost for those first 2 levels of hearing aids. And these are great hearing aids. Literally 0 out of pocket. And I've used these, and they're fantastic. That's a great, great benefit for all you old guys like me that can't hear. Also, this vision benefit is awesome. So I figure if you can't hear, you're probably blind like me too. So they're going to give you money in order for you to buy some new glasses or contact lenses and frames, things along that line. So instead of having to use your money, you can use Aetna's money. It's a great benefit, really is. So now you'll be able to hear and you'll be able to see. There's another benefit I like called Resources for Living. And what this means is, say you might have to have somebody come over to help build you a ramp up to your porch. Say you're in a wheelchair after stay at the hospital. Well, somebody will come over and help you do that, or maybe you need a ride to the drugstore, to the doctor's office. Well, they'll have somebody come pick you up and drive you there. It's a great benefit, especially if you live by yourself. Kind of gives you a sense of freedom. You don't have to rely on all your kids to do all this stuff. And let's say you did have to go to the hospital. Well, once you get out of the hospital, they'll actually bring you meals to your home, hot meals, like fucking good food like you get at Whole Foods or something. Great benefit, because you're not going to feel like cooking maybe, but you still got to have some good food in order to get better. It's a great benefit. This is included in these plans, by the way. Now, another benefit that I think is really good, we're going to go to the drugstore anyway and spend money. Well, this plan actually gives you money every quarter to go online and order things like, I don't know, Bengay, aspirin, bandages, vitamins, things you get at the drugstore that are not prescription. It's a great benefit. And again, the amount can vary based on the actual plan we choose. Also, for real dental insurance, most of these plans come with a thing called preventative dental, meaning cleanings and things along the line like that. And these plans have a $2,000 maximum benefit for things like dentures or partials or bridges or root canals, extractions, things along that line. And it pays it directly to the dentist, so you don't have to worry about getting reimbursed. It's really important, too, to take care of your teeth, besides just looking pretty. And this is kind of what the cards are going to look like. So it's all one card for your dental and your drugs and your doctors and your hospital. You just have to have one card. You show them the card. That's all you got to do. Their customer service number and stuff is on the back. Pretty nice cards, so that makes it easier for everybody. And once again, don't forget these benefits are above and beyond what Medicare normally offers. These free hearing aids, free eyeglasses, free meal delivery, free rides to appointments, free gym membership. Oh yeah, there's one more benefit I wanted to mention to you. And that benefit is, if you're ever diagnosed with any type of internal cancer, this plan is going to give you $10,000 of tax-free money sent directly to you if you're ever diagnosed with any internal cancer. For men, that could be the simple beginnings of prostate cancer, women, breast cancer. The odds of using this type of benefit is about 50-50. Think to yourself, how many people you know that ever had cancer? So you might be able to use that $10,000. Pretty awesome. Now you're probably wondering, great, what's all this going to cost you? Well, depending on your age, depending on if you're a man or a woman, it costs you anywhere between $40 and $80 a month. That's it. That covers your hospital, your doctors, your prescriptions, your gym membership, free hearing aids, vision, over-the-counter benefits, and it goes on and on. It's fantastic. That's what it's going to cost you to get complete coverage. That is what I call my Complete Advantage plan. When we talk together, I can kind of explain this in more detail. Things we're going to need to know are like what's your doctor's name, the medications that you're taking, things like that. And that's me right there. I'm Bill Gladden. There's my phone number, 816-806-6693. And as right now, I'm working out of my home office, as a lot of people are, because of this darn COVID pandemic. It's awful. But so I can take care of everything for you over the phone. And I can answer any question that might come up. We can just talk human to human. Imagine that. Okay? All right. Well, anyway, I hope this helps. Take care of yourself. Be safe. Be kind. Be strong. And we'll all get through this together.